Medicine Summit. We hope that you were able to attend our first one, as although I wasn't able to attend, I heard it was highly successful. So thank you again for coming back. Today we have us another special keynote speaker with us today, Dr. Scott Morris, and we'll be hearing from him on what he does at Church Health. But before we get into that, a few things I want to go over with everyone. Just a few housekeeping rules as Dr. Morris is presenting. Please be sure to keep your microphones on mute. Also, if you have any questions, be sure to either write them down on your own piece of paper or put them in the chat box for our Q&A session. And just to give you an order of service for this summit, I'm going to introduce Dr. Morris. He's going to talk to us about his work at Church Health, and then we're going to have the Q&A session afterwards, where you'll get to ask him some things that they did and things he presented on, and things you might want to implement in your own programs here in Mississippi. So, and another thing, I'm going to, at the end of this session, I'm going to let everyone know any updates we might have on the upcoming session on April 23rd. We're going to send a reminder email out to everyone here pretty soon. So just keep a lookout for that. So we'll go ahead. I'm going to introduce Dr. Morris. So Doctor, let me pull it up. All right. So Dr. Morris, he is the founder and CEO of Church Health in Memphis, Tennessee. Church Health opened in 1987, and its mission is to provide quality, affordable health care for working, uninsured people and their families. Church Health has grown to become the largest faith-based clinic of its type in the nation. And to give you an example of their reach, last year, Church Health had over 55,000 patient visits. Dr. Morris received his undergraduate degree from the University of Virginia, a Master of Divinity degree from Yale University, and his medical degree from Emory University. In addition to his background, he is a board certified family practice physician and an ordained United Methodist minister. Today, he's going to talk about their food is medicine model at Church Health in Memphis. So without further ado, I will turn it over to you, Dr. Morris.
Great, Terrence. I really appreciate this opportunity, and always love talking to people from Mississippi. I hope you all agree with me that Memphis is the capital of North Mississippi, and we fully embrace that, and I hope you do too. So I don't know how many of you actually know anything about Church Health. Maybe a few of you know something, I hope. Church Health, though, has been around since 1987. What we do is provide health care for people who work in low-wage jobs who don't have health insurance. And we do it in partnership with the faith community in a broader sense. So what we are not is a federally qualified health center. We're not a federally funded anything. We're a true charity. Muslim, Hindu, we really don't care. Every world religion out there has a commitment. We believe to care for our bodies as well as our spirits, and to care for the poor when they're sick. So our niche is caring for the people who work to make our lives comfortable. They cook our food, they take care of our children, they wash our dishes, they cut our grass, they'll one day dig our graves, they don't complain. Yet when they get sick, their options are very few. We saw 12 people the first day we were open in 1987. It's the fewest we've ever seen. There are currently 70,000 people in Memphis who depend on Church Health for their health care. Now that was before COVID. COVID, as you might imagine, has created great challenges for us. But in Memphis and Shelby County, 100,000 people lost their job. When they lost their job, they lost their health insurance. And today, whereas most people are working again, unfortunately, they have generally cobbled together 2 or 3 jobs at near minimum wage, and it doesn't offer health insurance. And when they get sick, their options are very few. Many of them do come to us. So that's very quickly an overview of Church Health. Now, I do want to just show you a very brief video if I can deal with the technology, not my strong suit, but to show you where Church Health exists. We are the anchor tenant of Crosstown Concourse, which some of you in North Mississippi may know, but I'm just going to show you the first part of video just to give you a feel for it. Can everybody see that now? I hope. So I will stop this, but this will give you a sense of the building that we operate in, where we have 150,000 square feet. So I'll shut up for a couple minutes.
So I'm Dr. Scott Morris, the founder and CEO of Church Health, and welcome to the virtual tour of Church Health at Crosstown. So in 1927, Sears opened a retail store with a distribution center where they distributed packages that were ordered out of the Sears catalog. The building ultimately grew to be 1.5 million square feet in size. It is the same size as the Empire State Building. It was unfortunately abandoned in 1992 and sat totally vacant until in July 8, 2011, a young art historian came to talk to me about ways that Church Health could help a bunch of artists turn this building into an artist colony. That was a crazy idea, but not only did we want to help, we wanted to move in there with them. So I'm getting ready to tell you and show you how this all came to be and what Church Health has now come to live into here at Crosstown. So Church Health is the anchor tenant at Crosstown. We have 150,000 square feet. You enter our space on the west end of the building, in the west atrium, right next to the FedEx office, right where we are headed in right now. I'm standing in the west atrium, right by the piano. And this is the main Church Health entrance, and these stairs. Church Health surrounds this atrium on all four sides on the first 3 floors, and we are going to go take a look at them. So we're entering the Dobbs Welcome Center. This is where everybody comes in. These days, we are very focused on the issues of COVID, so you have to check in. We're slightly close to Fort Knox, but not really, because we're welcoming and accepting of all who come through our doors. So when you get to Crosstown, your first person you're going to meet is Cynthia, the mayor of Crosstown. So here she is. Cynthia welcomes everybody who comes through our doors.
Yes.
So Cynthia, what happens when people come through here?
We'll assist them by verifying where their appointment is, and then we'll give them a wristband, and then we'll let them fill out the screening questionnaire, and then they can take it to their doctor's appointment.
And what will your attitude always be?
I'm going to always assist them with a smile and my team.
Great. So this is like no doctor's office you've ever been to. What we have is a pod system. There are 7 exam rooms designed for 2 doctors. So we have 52 exam rooms on 2 floors, half on the first floor, half on the second. They're all color coded because it allows us to care for people in more ways than just giving them pills. It allows us to have our counselors, our dietitians, our health coaches. We are a believer in whole person healthcare. It's not just about giving people pills.
Okay, so I'm going to stop sharing that. If you wanted to see the rest of the video, you just go to our website, which is churchhealth.org. I was beginning to talk a little bit about our view of health, which is what I really want to focus on now, and how this really plays into our topic of food as medicine. So to really understand the way Church Health works, you have to fully engage in what we see as health. So being healthy is not about the absence of disease. The World Health Organization would agree with that. I'm guessing all of you would as too. You know, who cares if you live 2 years longer, if it means 2 years longer in a nursing home? You know, life for life's sake can't possibly be the point. Breathing in, breathing out. None of us are signing up for that. So what it ultimately means, we believe, for all of us, is if you want to be healthy, then we should be engaged in doing whatever we can to help us all achieve what we've come to see are the goals for living. So these goals for living, we would argue, are 3 things. This is true for you and me. It's true for our patients. We would say it's true for all of us. Those 3 things are this. Number 1, having more joy in your life. Number 2, having more love in your life. And number 3, being driven closer to those things greater than we are. Now, we would call that God. You don't have to call that God, but there are things in life greater than we are. So this is what we believe leads to being healthy: more joy, more love, being driven closer to God. But if that's true, it doesn't have a lot to do with the doctor. And we would argue being healthy has little to do with the doctor. Now, in practical terms, what does this look like? So it led us to create something we call the model for healthy living. So we would argue there are 7 things in life that are equally important to life and must be in balance if you want to be healthy. Now, again, each one of these things are equally important, and the balance matters a whole lot. So one of them is medical care. You know, people think of Church Health, they focus entirely on our ability to provide quality health care for people who are working and uninsured. You know, from that standpoint, there's not a problem somebody could have from the cradle to the grave we can't take care of. We have 20 physicians on our staff. We run a family medicine residency, so training Church Health and training young doctors in the Church Health way. But then we have 1,000 physicians who volunteer their time to see patients for us. That is not a made-up number. There's not any problem somebody could have from the cradle to the grave we can't take care of. And so the doctor donates his or her time. We have an arrangement with the hospitals that as long as the physician is donating their time, then we can admit people free of charge. And so literally any problem somebody walks into that has a medical component to it, we can help with. However, only 10% of anybody's health outcomes, and I'm sure y'all know this, has anything to do with the doctor, 10%. We're currently spending $1 trillion a year in America on things related to the doctor, the hospital, and drugs, and it only has 10% to do with your health outcomes. Now, you could argue we're not spending the money very wisely, right? So that's one of the things. The second is food. We're obviously going to come back and talk about that. But nutrition, our mothers told us we are what we eat. They were right. The third is movement. Our bodies were made to move. So at Crosstown, we have 25,000 square feet of Church Health space that we contracted with the Y to manage. We have a very expansive physical therapy program. The number one question we get asked by our patients is, when can I go back to work? Because if you don't work, you don't get paid. You don't get paid, your kids don't eat. So a whole array of ways that we try to fully engage people around movement. But then family and friends, you could argue community, emotions, work. We define work as those things that bring meaning to your life. And lastly, your faith life. But we would argue your faith life is as important as anything the doctor could do. So each of our patients are evaluated in some way or the form or another when they come to see us. And then where people are struggling is where we focus. So like 50% of people who come to a primary care doctor like me have no medical problem. You know, people come to the doctor for reasons they used to come to the priest. You know, all over America in our hospitals, people show up in the emergency room with pain in their chest. And then we will do an EKG, we might do a CAT scan, an MRI, a cardiac catheterization, and everything is normal there. And the problem there is that you can MRI somebody's chest all day long and you will never know what a broken heart looks like. And I got no effective pills for a broken heart. So in our setting, once the doctor realizes that this is actually a matter of the spirit, we are able to call in one of our counselors. The counselor could spend an hour in the exam room and the doctor keeps moving, doing what the doctor's better at. Or if somebody weighs 400 pounds why exactly would we start with the doctor? Instead, we start with the dietitian. We move to our health coach. These are all embedded programs within our system. And then rather than the doctor shouldn't all over people, tell them they should do this, they should do that. You know, if you think somebody really needs to exercise more, don't tell them to do it. We just get up out of the exam room and go for a walking visit on our indoor track inside Church YMCA. Again, all of this is part of our system of care. Now, the food is an extremely important part of what we do. Food is medicine, culinary medicine. Prior to COVID, we had formed a partnership with Tulane Medical School. Some of you may be familiar with their culinary medicine program. To be honest, COVID has given us an opportunity to rethink how we do this, and we are now marching out on our own. I'm going to show you in a minute some ways we are doing this. But we have a teaching kitchen, a really dynamic nutrition hub that we call our nutrition hub. It was paid for by FedEx, so we're sort of taking the hub concept there. But it begins with a program that is focused, number one, on teaching young doctors how to engage patients around food. Now, I can assure you, most doctors, when they finish medical school, they don't know squat about nutrition. I mean, there is very little true education that they can offer patients because they themselves don't understand it. So we have developed a curriculum. This is where we did work extensively with Tulane over teaching young doctors how they can educate patients around food. And the way you do it is you actually get them in the kitchen and you turn them into chefs. It's like, again, we run a family medicine residency. You want to be a family doctor, you come to the Church Health Baptist program, then you are going to learn how to cook and learn how to engage patients around food. And you're doing it by actually getting in the kitchen and using the curriculum that we have, teaching young doctors how this works. But part of why we've moved on from our relationship to Tulane is it can't just be about the doctor. None of this can just be about the doctor. So we are now engaged in teaching any kind of healthcare professional, but it has to go beyond just that. So I'm going to come back in a minute and talk about how we engage patients, but another piece of all this is within our nutrition center, we cook meals with volunteers. So it costs $25 to volunteer with us. And then as a group, it's a lot of fun. We will cook meals where the volunteers are actually learning their own curriculum around food as medicine. And then the meals they cook, which usually are about 200 in a session, we then distribute to our patients who we believe are food insecure. So when you leave the clinic that day, not only do you leave with a pill, which the pill may not work, you can leave with food for your family for that night, and we begin the introduction with our dietitians. Now, Will, one of the things that COVID taught us is we are probably never going to have face-to-face meetings with our dietitians and our patients because what we now do is through Zoom, we can actually have that visit in the patient's home, and we can look directly into their refrigerator, into their pantry. And this has just become such a more robust way of our dietitians engaging our patients. So our cooking program where we deliver meals has become very robust. We've continued it even through COVID. We then, one day a week, the Mid-South Food Bank is here on site, and now we can distribute food in our partnership with the food bank as people leave the clinic and they're given a prescription for food that goes beyond just taking the pills. Now, I'm going to show you. Can everybody see this? I hope. Is that a yes? Maybe I need to go back and share my screen here. Let's see. Here we go. I hope you're seeing this. So we have a program now called Cook Well, Be Well, which if you're seeing this, oh Lordy. Hang on one second, y'all. Brianna, please come. Sorry, this is not my strong suit. Well, I need her. All right. Sorry, I can't get my slide up. Show here, slideshow. Here we go. Okay, here I got it. Sorry, I couldn't. Okay, I hope y'all are seeing that. So there are 4 sessions to our Cook Well, Be Well community cooking classes. Right here in the middle are the 4 sessions: getting comfortable in the kitchen, building a meal, pantry basics, cooking on a budget. These sessions we offer every Tuesday in person, and then we offer it virtually. We use these sort of ways to recruit patients through churches, through our own clinic. The options are either in person or virtually. And then you can just get a feel for the plan here. I'm sorry, this is somebody else's slideshow, not mine. Anyway, these are sort of, you can get a feel for our handouts that we have. This is one of the things that COVID has allowed us to really develop a robust plan around meals. There's not any meal that we teach people that we don't include how much it's going to cost. And then we have developed a way to do this through, whoops, y'all are in my way over here. I got to get over. Sorry, y'all, I can't. Brianna, come back. I need you. Bree, sorry. I'm going to show you a couple of videos, but for some reason I can't. How do I get them out of my way so I can click my thing here? There we go. Okay, there we go. All right, so y'all, here, this is a video that we now have a entire library on to give you a feel of how we're just teaching the basics of cooking, because we learned that what we learned is that our patients don't know the basics. And so this is a brief video here just about for a recipe. And I'll just give you a feel for it. We have a very deep a trove of these that we've been creating throughout COVID, and it's given us a great opportunity to make this happen. These don't have any sound to it other than the music.
Dr. Morris,
Yeah.
I don't think we can see the video.
Oh, all right, never mind. You can't see it, huh?
Are you, and you're sharing your screen, right?
I thought I was. They can't see it, so.
Dr. Morris, I think you need to close out your slideshow and then click on your video.
Yeah, that's all right.
That's it right there. I think that's it.
Can you all see it now?
Can y'all see that?
Yes.
Yes, okay, all right, well, sorry, y'all, technology. Not like that. Okay, so I'm just showing you this, get a feel for the content. And again, what we learned is that so many of our patients just really don't, I'm gonna show that other video. Go ahead, do it right now. So many of our patients just truly don't have basic skills. So we have a whole series of videos just like this. I hope you can see this. She's gonna show it in a second here. This is literally just a video on how to chop broccoli. Not what is this? This is on Brussels sprouts. You know, there's no sound to it, but it's just to let you know how to do it. So again, this is, you know, sort of take away that embarrassment of I don't know how to do something like this, and people can learn in their own home. We can do it in groups if we want to, but the portability of it is really pretty powerful. And again, we now have a deep well of just skill sets like this. Okay, so I'm gonna stop here. Okay. All right. I hope that I was not too disjointed by showing it to you that way. Let me just stop right now. It's 2:30. I'm happy to answer questions. I hope I'm giving you a feel for, like, you know, we are primarily a medical clinic, but our ability to connect in the broader sense as a community, the other deep commitment we have, that it is church health. So engaging in the faith community, and for churches, synagogues, mosques to become a place where learning to eat healthy actually makes some sense. You know, but one of the challenges we have is that, you know, the least healthy meal you could eat every week is at a church. You know, particularly here in the South, we have blessed the sin of gluttony for the sake of fellowship. In the midst of the obesity epidemic in America, clergy are 20% heavier than the rest of the population. So we offer classes specifically for church cooks to go through this same sort of training for them to be able to cook a larger congregational meal, for it to be healthy. And then we will offer support so that if everybody hates it, if you need a counselor, so you'll try again and you're just not going to give up and go back to fried chicken. In all seriousness, encouraging church cooks to try something different than just what everybody wants is easier said than done. But what we have learned is that if you can engage clergy and you decide, and that clergy decides that they want to eat healthy, just magically overnight, that congregation is going to start eating better. That's especially been true if the pastor has diabetes or their own issues of heart disease. So we try to really target them and focus on ways that a congregation can lead the way. And I think that works in Mississippi as well as Tennessee. All right, I'm going to stop, and if you have any questions, anything's fair game.
Right. Thank you, Dr. Morris. That was a great presentation. And I think especially since you all take it from a ground level where you actually teach people how to chop up Brussels sprouts or broccoli, things of that nature, because that could be a barrier for some people in their pursuit of a healthier diet. So we already see some questions in the chat. And I think the first one we can start with comes from Tom Pittman. And he wants to know, does it make sense to prescribe produce? And I think essentially, Tom, correct me if I'm wrong, you're asking, what are the pros and if any cons to prescribing produce in communities, especially in Memphis and in Mississippi?
Yeah, so this is one of those things that there's, it's sort of cool these days for the doctor to write a prescription for produce, and people think they're doing a lot of good. There's a lot of potential to do good. I can tell you, our experiences oftentimes is if people don't know how to cook the produce, if they have never really had it in any creative way, first off, the produce is going to go to waste. And then just writing a prescription for produce, it may not accomplish the goal. So the plan has to be deeper than that. It has to be more robust than that. Again, we believe that congregations can become a very deep source of educating people and doing things collectively, doing it in groups. You got a lot better chance of finding a way where my friends and I are going to go do this together than just the doctor told me to do. That becomes back into that, the doctor shouldn't all over you, and shouldn't all over you rarely works. You got to hold people's hand a little bit more than just writing the prescription. At least that's my point of view on it. So.
Yeah, absolutely. So we'll go to our second question. John Green is asking, can you say more about the prescription process you mentioned in Church Health in collaboration between Church Health and the Mid-South Food Bank?
Yeah, well, Sharon, can you unmute and you talk about that? I see our person who runs this program, I didn't know she was going to be on the call with us, and if she can unmute. Are you there, Sharon? Maybe you can't unmute.
I'm here.
Oh, okay.
I'm here.
Can you answer that question better than I can?
Okay, could you repeat it one more time?
Yeah, John is just asking, can you elaborate more on the collaboration between Church Health and Mid-South Food Bank?
Sure.
Yeah.
Okay, so Mid-South Food Bank, they received a grant through United Healthcare, and it's an ongoing grant to provide food boxes that include a lot of fresh produce, and then in addition to that, some healthy, shelf-stable food. And they reached out to Church Health because of the population that we serve. Typically, a lot of them are food insecure. So we are one of 3 clinics in Memphis that they distribute food to their patients. So the patients, all they have to do is answer the 2 food insecurity questions that you all are probably aware of. You know, do you ever worry about running out of food? Have you, that's one of them. And then the other one is, I'm trying to remember exactly how it's phrased, but do you ever?
Hi, welcome. My name is Carolyn. This is our Cook Well, Be Well Knife
Oh,
Skills
your
class.
video's on.
They will be going
Oh,
over
Lordy.
some
Okay. I don't know how to
various
do
knives
that.
and knife skills.
But anyway, they answer the 2 food insecurity questions. If they answer yes to either one, they qualify. We don't ask for any personal information. We have a lot of the Hispanic community that come to us as patients, and we don't ever want to put them on the spot, but they are welcome if they're food insecure. We have a lot of people from the neighborhood that come as well that aren't necessarily our patients, and the food bank has allowed them to receive the food as well. So we serve somewhere around it could be anywhere from 400 to 800 a month of these boxes and bags of food. Even some of the people that work in Crosstown at other companies in Crosstown are food insecure and actually get food. So it's all funded through United Healthcare, and we partner with the food bank on that. Does that answer your question?
Okay. Thank you, Sharon. My next question would come from Anna Kleiner. How does someone qualify for your services at Church Health? Can they already be covered by Medicare, Medicaid, or a plan via the federal exchange?
Yeah, so Church Health's niche has always been working and uninsured. So that we do within our residency take some people on Medicaid, and again, we do take people on Medicare, but our niche is you don't qualify for anything. You know, in both Mississippi and Tennessee, you know, neither one of our states expanded Medicaid through the Affordable Care Act. And what you may not know is that the exchange, healthcare.gov, in order to get a subsidy for health insurance from the federal government, if your income is below, not above, below 138% of the poverty level. So that in Mississippi and Tennessee, that's roughly $12 an hour for a family of 4. So of our 70,000 people that depend on Church Health for healthcare, more than 90% of them fall in that category, below 138% of the poverty level. When they go to healthcare.gov, they put their income information in. Do you know what it tells them? It says you should apply for Medicaid in your state. Only neither one of our states expanded Medicaid. So what that means, the impact of the Affordable Care Act on the working uninsured has been nothing. You know, Jesus said the poor will always be with you. So far, he's been right. I just don't think he ever thought there were going to be so many poor people. So again, our focus is in that niche. You know, that person who's working 2 jobs, making $8 an hour, which there's ridiculous number of those jobs out there. Anyway, for better or worse, that is who we focus on.
Yeah, that's a very unique group of people that you work with, and you can tell from your numbers from last year, you reach a good number of people. So we'll go to our next question from Brenda Smith. She has 2 questions actually. Are your videos on food prep / cooking available to share with food pantries and nonprofits in Mississippi? And I believe, Dr. Morris, they were on YouTube, right? The videos that you shared?
They were. I'm going to let Sharon answer that question too. Okay. You're on mute. Yeah.
This is the first time this question has come up. And to be honest, we haven't thought through this enough. What we hope to do somewhere down the road is to license this curriculum possibly, and then it would be available for others to use and teach and we would probably have some sort of train the trainer. But we haven't gotten that far with it. We actually just started rolling these classes out in the last couple of months. So this is all new. We spent our COVID days creating this curriculum. And so right now, I would say the answer is no, until we figure out if we're going to license it. But if anyone is interested in creating videos, we would be happy to share how we did that. We just used a phone. I mean, it's that simple. So we'd be happy to share that with you. And we're always happy to share recipes. We have lots and lots of recipes that we could share if a pantry wanted to have an array of seasonal, for the seasonal produce, and they wanted some recipes to put with that seasonal produce, we'd be happy to share that.
Sharon, could you talk about how the recipes are tied to cost?
Yes. So when we think about our, the clientele that we serve, they have a very, most of them are on SNAP benefits here in Tennessee. And so it's a very limited budget, but we really can show them how they can eat healthfully on that budget by buying seasonal foods. Usually if foods are in season, they're cheaper than if you're buying things that are out of season. So we talk a lot about that. We also talk about bulk cooking and then freezing. That way they can save some money. We talk a lot about meatless meals, getting your protein with beans and legumes and other sources of protein that are cheap, eggs, that sort of thing. So the Mediterranean diet is the perfect diet to teach because you can eat healthfully on a budget using the Mediterranean diet principles, and it applies to almost every chronic illness as one of the best recipes for management. So and then we try to give them some idea of what it would cost. Most of our recipes feed a family of 4. We show them how to either reduce it or increase it depending on the size of their family. So all of that is considered part of our cooking skills piece of the curriculum. We go over all of that.
Yeah, one thing I didn't emphasize, but Sharon did just then, is that everything we do is driven by the Mediterranean diet. So we have, swallowed hook, line, and sinker the argument of using the Mediterranean diet. So that is where we are, and at this point we're fully committed.
Yeah, and if y'all research it at all, you'll find, there's so much research to back that up. The other thing I'd like to point out is the third piece that we incorporated into the curriculum is the Church House Model for Healthy Living, which looks at it's like a life balance tool, basically, and we teach them how to use that. And for them
That's what I referred to when I first began, about the 7 things that I talked about.
So all of that is embedded in the curriculum as well.
Which is actually important, y'all, because when I told those 7 things, it can't just be about one of them. It can't just be about the medical component, but neither can it just be about food. All 7 things are equally important, and they must be in balance. In your own life, rate yourself 1 to 10. See how you think you're doing around medical, nutrition, movement, family and friends, emotions, work, your faith life. Put that in a circle, and then connect the dots. And you want to create the biggest circle you can, and that will roll. For most of us, it doesn't roll very well. And where you have the lumps is an indication of where you ought to be working on it. And so we do that with all of our patients. But even if they start in the nutrition center, then we're not just talking about food. At every level, we're always looking at what it means to be a whole human being.
Yeah, thank you. I know Brenda had another question attached to it first. One of the second question, I think Scott, you or Shan could probably answer this question. She wants to know, and to let you know that the people on this call are mainly people that run and work with food banks and food pantries. So the second question is particularly important. That Brenda wants to know, are any training sessions available to nonprofits? so they can share with their clients? And also I'll add to that question, how accessible are these trainings, if any, how accessible are these trainings to food banks and food pantries at this stage of the pandemic?
Go ahead, Sharon.
We haven't done any trainings with the food banks. We've talked about, giving some adjunct material like educational materials or cooking skills materials to them, but we have not done that yet. We're like I said, we really just finished this project and figuring out all the ways we can use it. I mean, it's just endless, all the possibilities that we can do. Some of the work I'm doing right now is with Shelby County. The Shelby County schools are involved, and it's all through the Healthy Memphis group, and help. It's all about nutrition education and how can we get that out into the community, and what are all these different avenues where we can go. And one of those is through the schools, like through the parent teacher associations and things like that. How can we get that information? Because the children are getting it, but it doesn't always get to the parents. So, we're looking at things like that, but we're not particularly partnering with any pantries or the food bank right now as it relates to nutrition education. Actually, our food bank has a demonstration kitchen in it, and they do offer some cooking classes there. We're just not the ones delivering it.
So how do people get access to those cooking classes at the food bank?
I would say go to their web address, and there might be some contact. I'm happy to find out for you, and I could get that to you, Terrence, if you want, and then you could share it with the group. I think Southwest dietetic students are the ones that teach the classes, but I'm not 100% sure on that, but I can find out for you.
Oh, thank you so much.
Sure.
And I see one more question from John. He wants to know, are there any church health affiliated programs in Mississippi or being developed in Mississippi?
I'm glad you asked. We have an entity called ECHO, which stands for Empowering Church Health Opportunities. It is all about replicating the work of church health around the country. And within the last 6 months, Tom, I forget exactly when Trinity Healthcare opened in South Haven. And it's only been open for 2 or 3 months, but it is up and going and full bore. And, if y'all need to get to know them better. They're going to do a fantastic work for North Mississippi. That they are totally modeled after the way church health works. Now there's just started. They just opened their doors, but it's going to be a good thing. I mean, Tom Pittman, you may want to say more about them. You know a lot about how it's come to be.
Well, thank you. Yeah, it started very, very small, just the way church health started in Memphis with 12 patients. So it started very small, but it's moving along. It's got a great model. Kim Remack, Betty Carson, some key individuals are making that happen with fundraising. And it's in Horn Lake, just off Goodman Road, just west of Highway 51. So it's a great central location for DeSoto County. And I'm sure other counties would be welcome there to come and learn and see what they can do there.
Looks like we have good news coming to Mississippi. Do we have any more questions from anyone else?
Look, I would invite you if you're in Memphis and want to come see Crosstown and see what we just talked about firsthand. We would love to have you here, especially if you've been vaccinated. We would welcome you to come take a tour. But you could contact me or Sharon, or just our website is churchhealth.org, and contact us that way. But yeah. come visit.
Okay. Seeing no questions, I want to thank you, Dr. Morris, for taking the time out on this beautiful Friday. As long as we still have a beautiful Friday, as long as the storm doesn't come in and mess it up. Dr. Morris, thank you. Sharon, also thank you for having your input on this. This helped out everyone, I'm sure. I see your message in the chat. I will include your email on our follow-up email with everyone here. Dr. Morris, I'll also include the website and your contact information so they can ask you any questions they might have about implementing certain programs in Mississippi and the new Church Health affiliate that's coming in Horn Lake. Also, everyone, in that email, I will include a reminder that our next Food is Medicine Summit will be April 23rd. We will hear from our Harvard partners about how states and local municipalities can mainstream their produce prescription programs here in Mississippi. So I want to thank everyone again for coming, and also make sure you enjoy your lovely weekend, and we will be sure to stay in contact.
Great. Thank you for having us. Appreciate it. Take care.
Right.
Thanks.
Have a good weekend.